Dear colleagues, I'm Leo Biscaro and I would like to present to you the book on the terminal dentition which will soon be published by Teamwork Media. Let me clarify straight away what you will not find in the book. You won't find the explanation of all those basic concepts like osseointegration, implant stability, periodontal health, all concepts that should be taken for granted by whoever treats these patients. You won't find a lot of references because in the internet era, a book is the least suitable place to analyze literature. And you won't find a lot of surgery because, at least for me, these cases are primarily prosthetic cases. So, what will you find? Dentistry is living a particular moment because there is the impression that it's shifting from a medical discipline to a cosmetic one. Instead, in this book, you will find more or less 70 cases in which the oral health is seriously compromised, treated with different approaches, presented with almost 2,000 photographs, but in particular, you will find what is rarely, if ever, discussed: the clinical and technical analysis of the factors which are really essential in treating these patients with a philosophy that maximizes ergonomics and the quality of life of the patient during treatment. Above all, the book deals with planning, with the fundamental role played by the dental technician in planning the case, in identifying before starting the treatment the objectives that can realistically be achieved with the treatment. A lot of space is dedicated to the type of aesthetics that can be achieved in these patients, and especially to the relationships between the residual teeth and the face as the most important element from which all the planning starts. But special attention has been dedicated to the analysis of the factors that can prevent the ideal treatment objectives to be reached, and to one in particular which is never considered, but which is for me the most important: the prosthetic space. The strategies for increasing the available prosthetic space are illustrated from both the surgical and the prosthetic point of view. The possible alternatives for treating the terminal dentition with gummy smile are analyzed, with very demanding cases treated with different approaches. But how can we prosthetically use the information collected in the planning stage? Chapter 7 provides step-by-step explanation of the one model technique, the procedure that we have been used for years to manage immediate loading also in the most difficult cases. But the key for reading the whole book is the importance of having a treatment strategy to reach what is for me one of the most important treatment objectives: to guarantee the patient a maximum comfort, not only at the end of the treatment, but mainly during the management of the treatment. Because nowadays this point is determinant for the patient's perception of the quality of our work. So I leave you with Sarah's smile, hoping together with the friends with whom I wrote the book, that every page of the book will be useful to you in your daily practice.